Welcome to Soleo Health, where we help you simplify your complex care. In this video, you will learn to administer your infusion using Minibag Plus. Store all medication as directed. Some medications need to be refrigerated for stability. Remove one dose from your refrigerator 1 hour prior to infusing to allow the medication to warm to room temperature. Never heat or microwave the medication. Use each vial and bag only once. Change the IV tubing as directed by your nurse. Wash hands thoroughly using soap and water for at least 20 seconds. Dry with a paper towel. Use your towel to turn off the faucet. With an antibacterial wipe, clean your work surface. Gather supplies on your clean work surface. Medication vial and bag, IV tubing, alcohol wipes, flush syringes. Inspect your IV site for redness, swelling, tenderness, or warmth. If there is a change, do not infuse and contact your nurse. Inspect your medication. Is it expired? Is it the right medication? Is your name on the bag? Are there any visible specks or floating particles in the medication? Each dose should be free of cracks, leaks, floating objects, and discoloration. If you have any doubts, call your Soleo Health pharmacist. Bend up, then down to break the seal. Hold bag with vial down. Squeeze solution into vial until half full. Swirl to suspend drug in solution. Do not shake. Hold bag with vial upside down. Squeeze bag to force air into vial. Release to drain suspended drug from vial. Repeat these steps until vial is empty of drug and solution is thoroughly mixed. Ensure drug is completely dissolved. Do not remove drug vial. Remove port protector. Hang bag on IV pole. Ensure that vial is empty of drug and solution. Remove tubing from wrapper. Close the clamp. Remove protective cover from the IV tubing spike. Push the spike in the administration port, making sure you do not touch the spike. Squeeze the drip chamber on the tubing until the chamber is half full. Open the clamp to fill tubing with fluid. Allow the tubing to fill completely. When the fluid reaches the end of the tubing, close the clamp. Swab the end of your IV needleless connector using an alcohol wipe. Allow to air dry. Do not blot or fan. Remove the cap from the saline flush. Holding the saline syringe upright, gently pull plunger back to loosen and then push the plunger up to remove air from the syringe. Gently but firmly flush your catheter with the prescribed amount of saline. Swab the end of your IV needleless connector using an alcohol wipe. Allow to air dry. Do not blot or fan. Remove the protective cap from the end of the tubing and attach the tubing to your needleless connector. If your tubing has a dial, set the dial to the prescribed rate. Open the clamp to start the infusion. When the infusion is complete, close the clamp. Disconnect the tubing from the IV needleless connector. Swab the IV needleless connector with alcohol and flush the IV catheter with saline flush solution as before. Swab the end of your IV needleless connector again with alcohol and allow to air dry. Follow with a heparin flush if instructed to do so using the prescribed amount. Call your nurse if you're unable to flush your catheter or meet resistance. Apply antimicrobial cap to needleless connector if provided. If administering 2 or more doses per day, place tubing cap on the end of the tubing if provided. Keep the spike in the bag of completed medication until you are ready to spike the next dose. If there is air in the tubing from the previous dose, prime the tubing as instructed. After the last dose for a 24-hour period is administered, discard the used medication bag and tubing in the appropriate waste container.
you.